Take it away.
Great. Hi everyone. My name is Kara Copeland and I use she, her pronouns. I am with the Common Thread consulting team. I'm going to go ahead and share my screen over here. Okay, we're live. Yeah, thank you, Christy and Joylene. I think the feeling is mutual. We've had such a great time learning from and with the SOCAC team. We particularly have been working closely with Joylene and Alicia and Annette, who are the family representatives as a part of SOCAC, and they've been great to work with and work alongside. Many of you met with us early on last fall. We did some listening sessions with the system of care regional coordinators, you all, and some of your team. So you have met with Susan and I and Vanessa before. And today we're just going to share with you a little, just a little bit. I couldn't actually fit everything into one presentation and also make this a little bit more interactive and not just me talking at you because we all know you can read slides that I could just send to you and you can read a report. But I'm hoping that this will be a time that we can really be in conversation with one another around why this matters. Why does engaging with families matter? Um, Julian, maybe you could help me out with, or Christy, help me out with the chat as I'm navigating multiple things. If things are coming up, I will try to make sure that I'm monitoring that. But please, if I miss something, let's be really informal. And if you have questions, raise your hand or whatever the norms are here. Happy to go at the pace that feels right for learning together today. All right, so let's carry on. A little bit about what I hope that we walk away with today. I hope that you all learn some of the results from our family engagement project. You're going to hear today what families said. We'll tell you a little bit about kind of that engagement that we've done with families and continue to do because it's not a one and done process, right? Families continue to bring their voice, their leadership, their experiences to both to us and to your organizations, and we'll continue to integrate that. And then as we have time at the end, I brought an interactive activity to allow you to be able to think about how family engagement is going at your local system of care or within your organization. So we're going to practice doing a little bit of thinking and reflecting on how we're feeling about family engagement. And we're going to talk in a little bit about what do I even mean by family engagement, right? So hold on, we will get there. Let me introduce you to my teammates. They are not able to be here today. Oh, I see my teammate Vanessa is there, is on the call. Vanessa, I'll give you an opportunity to introduce yourself, but let me just introduce you to Susan Fisher Mackey, who is the owner of Common Thread Consulting. And she's been involved with this project. And we do, as a team, we do a lot of system work. We're working with several state agencies and systems and then local small doing small projects as well. Vanessa, would you like to come on and introduce yourself?
Hi guys, Vanessa Broadley. Thank you guys all for being here. We really appreciate you guys taking the time to. I know you guys are your days are busy, and hope you guys are able to take something from tonight. We're also open to any questions, additional feedback post today. So just thank you guys. We appreciate you, and hope you guys take something from what we're going to share.
Great. Thanks, Vanessa. Okay. So let me just share a little bit to give you the context. As Christy mentioned, we have been working with SOCAC since early or late summer, last summer, maybe early fall. And these are some of the things that are part of what we were doing, tasked to do with this project. So the primary purpose of this engagement was to increase the capacity of SOCAC and their committees to lead a system of care that more justly leads with family voice and experience at the center. You all, I believe, last month also heard from the Youth Voice program or contract, and got to learn a little bit about the new things that the youth are asking for and wanting to change. So this is the family engagement. And again, when we just to center, when we're talking about families, we're talking about families that have children that experience Oregon's system of care. Um, so we put together what is probably an iterative landscape and opportunity map. Again, that particular piece of our project was just to get the lay of the land. Where are all of the places in Oregon where families can have their voice be heard? So whether that's and we tried to break it down by different kinds of family experiences. Whether you are a rural family, where do you go to have your voice heard? If you're a family with a child that has disabilities, where do you go to have your voice heard? We have and many, many other places where families have experience that we really can learn from. So that we have that landscape and opportunity map. Early in January, we did an advocacy, or February, I guess, we did an advocacy training for families. So we talked about how a bill becomes a law. How do you even advocate to change law here in Oregon? And we are just at the tail end of legislative session. One of our state's longest, our state has one of the longest legislative session, but we had opportunity to spend time helping families know how to navigate and ensure that their voice is heard. We've been every month supporting the brand new, hot off the press Family Advisory Council. So Vanessa, my colleague, has been walking alongside Joylene and Alicia and Annette as they work to stand up that council. Vanessa, would any comments that you'd like to make about that particular part of our project?
I mean that has really been more so a supporting role and really being able to see how amazing they are at really just um using all of their knowledge, not just within local and regional systems, but what they have done at the state level and really advocating for themselves and taking those steps to really increase access or reduce barriers for families that really are intertwined with the system. So, very little for me to say. I'm really just there supporting and cheerleading for them and doing whatever I can to support their work. But they are all amazing, incredible human beings, and they're just doing great work. So, I'm excited for y'all to see once more things roll out through them, just the amazing work that they're doing. And for those who have supported them starting their journey locally and helping them now go to the subcac, thanks to you guys, because yeah, these are amazing individuals.
Yeah. Thanks, Vanessa. As many of you know, anytime you start a new project or initiative, that on-ramp just it takes a minute. And by a minute, I mean maybe years. So we're happy to see that group coming together and really starting to get their feet underneath them. What we are currently working on with that group is this family engagement plan. And again, think of this like kind of like a strategic plan for SOCAC and SOCAC's committees of what are the actions, opportunities, enhancements that SOCAC could consider. And so part of what we have done to inform that plan was to do listening sessions with families. So we conducted, you were able to see in some of the materials that were sent out, we conducted a lot of focus groups in both Spanish and English, followed up with some individual interviews with families that wanted to just talk with us even further. So We are now taking that information and working with the Family Advisory Council to really refine it, ensure that the words that are used in that are their voice and what they want to see happen in the next few years at SOCAC. One of the last tools, items that we've been working on was we did we did all of the research around what kinds of tools are out there to measure family engagement. And there are a lot of different, that report is coming out and you all will probably be privy to that, I would guess, at the end of this month. But we did a survey of literature, found various tools, looked at the efficacy of those tools and what the kinds of things they measured, and are now working with the Family Advisory Council to look over that tool and ensure that it is the one that really captures what they think they really would like to measure in terms of family voice, family engagement, and family leadership. And this last part is just capacity training and development. So that's what we're doing here today is a little bit of training and then a little bit of reporting out. But we hope that in all of our conversations that we've been in with people that we've helped be a thinking partner and help to ensure that the system and the system of care staff have the support that they need to think through this really important work. So I'm going to pause there. I'm just ask if there are any questions. Really, this is a summary of what our project was. Okay, let's move on then. A little bit about how Common Thread Consulting does system change work. One of our frameworks that we use is called the SOAR tool, and many of you who have done either strategic planning or work within a group might be familiar with like a SWOT analysis, and that can be a really helpful framework. We have chosen to use the SOAR tool and because it really helps our brains think about the future and what can be, and not perseverating on getting really stuck in what is. Sometimes in that SWOT analysis, we get lost in those weaknesses, right? We get lost in some of those threats, and we forget to take a breath, see the future, see what could be, and talk about strengths. What is already working that we're already doing? And many of you, when you were in focus groups with us, you heard us talk about what is going well. That's what we led with families as well. What is already working for family engagement? What are some of the opportunities that we see? Again, looking around, here's where are the opportunities to connect, the opportunities that are on the horizon, and then really looking at aspirations. If you could have a magic wand, what would it look like to really see family engagement actually working? What does that look like? And then the results are how do we measure that? So once we know that we want to have family engagement, we know what our aspirations are. We look at what is the way that we want to move out of problem solving and into measuring that. Just a little bit. So I want to do a little bit of interaction now with you all and just ask you what family engagement means to you. And what I'm going to have you do is if you have something to write on, just write down in a sentence or two, just take a minute to think, what does family engagement mean to you? So let's just take a moment to think about that. I don't know if any of you would be willing to share either in the chat or come off mute and share with us when you think about family engagement. what does that mean for you? Any thoughts?
I, I'll, I'll go. I'm Annette Marcus from Oregon Family Support Network. And I guess what it means to me is that families are not on the margins, but at the center of making decisions, of providing input and leadership, and that we are supporting those families to be able to do that.
Mm. Thanks, Annette. I heard leadership, I heard support, all great action items. Someone else, what did you write down of what does family engagement mean? Maybe even for your organization. Yeah, Adam.
I guess I think about family engagement as like genuinely recognizing families as experts in the work, um, and equal partnership at the table as decisions are being made. Um, yeah, that's kind of where my brain went.
Right. Absolutely. Thanks, Adam. In the literature, and Portland State University did a great, has a project going right now in Douglas County, or just wrapping up a project around family engagement in Douglas County, developing a family engagement playbook that will be out later on this month. So I'll make sure to send that around. But when we think about, there are different levels and different kinds of family engagement in the school system, for sure. If any of you who are a parent, like I am, might remember, parent teacher conferences, or any of you who've been through the school system, maybe you remember, like, oh yeah, going to parent teacher conferences. So in schools, we think about parent engagement of how do we get parents involved in what their child is experiencing. And then you move up to some leadership in school systems, like what the Parent Teacher Association is another example of what parent engagement might look like. So we're going to talk a little today about what we mean by family engagement. And this is the definition that we are working with. And I think I heard flavors of you all sharing this as well, that that this is a collaborative partnership between families with lived experiences and systems to co-create policies, practices, and programs that affect children, youth, and families. So again, I've highlighted some key words, and Adam, I heard you say this too, about a partnership and this co-creation. So it's making sure to elevate not just family voice and not just system voice, but how do we have an equal partnership, when we each have a role to play. And part of the unique nature of working with groups, and I've run a family parent advisory councils before, as maybe many of you are running, is getting really clear on what are our roles, what are the roles of the group, and so that you're level setting really appropriate expectations, I think would be one of the first things that the literature says both, and probably some of you have learned both the good way and the hard way, is that having exciting expectations, but also really setting expectations for families, and for system partners, so that you can avoid that disappointment of what we thought we were doing, and that we have really good transparency. That's how we build trust. So, any comments on either this definition or what this brings to mind for you, or experiences that you have had either as a parent or as a system leader? Thanks, Priscilla. Appreciate you putting that in the chat. Yeah, recognizing and actively involving families as central and valuable partners. Right. I think that yeah, this term of family engagement. I spoke with an organization who has actually moved away from family engagement, and this family involvement is, again, finding what words mean to us of like how do we involve families. And the slide that we're going to look at next is another way to look at levels of family engagement or levels of family involvement. And this particular slide, I hope that you can. I know the font is a little hard, might be hard to read, but perhaps you can read this. But this comes from Nurture Connection. They have a family leadership council. And Nurture Connection, some of you may be familiar with Dr. David Willis. He's been an organ pediatrician for a long time, and Dr. Willis now is over on the East Coast. But he has led this Nurture Connection organization. And when we look at this, and there are other models to look at, we look at involving families with different levels of involvement. And I guess, this first one starts with inform, but I have a challenge for you. I feel like there is a step before informing families. Informing families is where we just are like think about sending emails or sending notes home if you're dealing with children at school. If we're letting families know this is what is happening to and for and with your children. But what is the step right before inform? Anyone want to take a guess? Yeah, Hillary. Hillary got it. Well, Hillary at least was thinking what I was thinking. Ignoring families is the step before informing families. And I feel like, of course, this model is making the assumption that we are not ignoring families, that we're doing what you all have suggested. And what we know is important is that elevating the important role that families play in our systems. So let's just look at this a little bit. And again, because this is the system of care collaborative, I want to think of like what the system goals are. So when we're informing parents, the system goal is that parents are provided information, resources, and opportunities. I love to they list out what parents might experience, what parents gain from that. And this last one is really important, is the equity driver. Do parents find it accessible, or are economic barriers removed? So we move up from that a level. We move from informing parents to now parents are participants. Parents with lived experience, we care about your thinking and experiences. The system goal here is that parents are providing input and support in decision making. So this might look like we have a policy or a program that we're getting ready to launch. Before we launch that, we want families to give input, to weigh in, to tell us what they think and give their thoughts. And then we move up from that a level. Let's move up from participants to engaging parents. And this is where parents start to have more of that leadership role. And I heard some of you put in the chat and talk about families as leaders. And this on this level, families are saying, you are teaching us, and because you are teaching us, we are taking different actions. So families are really supported, again, to be able to be leaders. And again, there's the what parents gain from that. There's some shared lived experience and expertise so that policies, programs, and services meet their families' goals. I like this equity driver particularly because we have to make sure that parents understand the purpose of the group and why their voice is important. To me, one of the things, and I really want to spend some time on making sure I state this again, being really clear on roles and expectations is important. Otherwise, we're setting both the system and the families up. We're not setting them up for success. We move from engaging families to a partnership with families. And again, this is where parents become the key consultants. The system goal is that parents are the co-designers and support planning and decision making and the implementation and evaluation. And in a little bit later today, we're going to be doing an assessment tool to just kind of see where you are at with this. But I think you could reflect on some of these of where do our parents partners in your system, or are parents simply informed of decisions that you've made? And the last, this last one I would say is parents leading or parents steering. And this is where we have intersect, where the Nurture Connection, how they've described this as intersectional professionals. We need your expertise and positional power in our in our system, in our organization. And again, this is where we have intersectional professionals with dual expertise, right? And I know many of the families that are participating in the Family Advisory Council have a lived experience, also have done some training in how to and are working at organizations that empower parents. And so they really have this intersectional experience of being able to give their opinion. The system goal here is that you're leading with dual expertise, and that parents are driving the planning. Again, I think one of the litmus tests here can be where are the ideas coming from? Are ideas coming from system partners and you're hoping families will rubber stamp? Or are the ideas coming directly from parents themselves and co-collaborated, worked on, as Adam was saying, collaborated on with staff? So let me pause there and just ask for responses, questions. What comes up for you when you see this kind of a model? We're a quiet group today. I will trust that you are reflecting on your own and soaking this in, and you will get copies of these slides in case this slide is a little bit hard for you to read on your particular screen. Okay, I'm gonna stop sharing for a minute, but first we're gonna do a little Mentimeter. I need you to, on your computers or on your phone, go to menti.com, and I want you to use this code. So the code is 16573740. And the Mentimeter, I don't know, Vanessa, maybe you can put that in the chat for me. Or Joylene. It's menti.com 16573740. I'm going to stop sharing for just a moment, and then we're going to look at this Mentimeter together. Oh, maybe I can just do this. Let me just share this screen. How's this? Okay. if you have that code, I think you should be able to put in your results. There you go. So this is uh why does family engagement matter? Cohesion, collaboration, a working system. Nope, I'm not even sharing. There we go. Am I sharing? There we go. All right. Are you all able to use the Menti? Is it working? There we go. It is. There you go. Right. I like that word empowerment. Great. It builds trust. I love that. Gives us a working system. This idea of seeing one another. I love that. They keep moving around. Lived experience for change. It drives change. A lot about uh, change and why having that lived experience and family engagement matters. Awesome. All right, I'm gonna stop sharing that and navigate to this other window. Okay, let me go back. All right. So this is some of the things that we came up with as well, working with the Family Advisory Council, and what also the literature says that why does family engagement matter? Trust. Many of you said this on our Menti. When families see their input valued, trust grows between them and systems. Outcomes. Again, many of you said that on our Menti that engaged families are more likely to believe their voice can enhance or change the services that their child needs. And change is this last one. Many of you mentioned this as well. By positioning families as active collaborators, the continuous feedback loop informs stronger policies and services that families actually need. I'm wondering, I'm going to pause here. I'm going to continue to ask questions to this group. Can you think of a time when something in your organization or a role, maybe you were a family, where outcomes or things changed because of family engagement and listening to families? What are some things you have seen happen in your spaces?
Well, this is an example, not hasn't happened in a space recently, but I was part of a group that was looking at how does child welfare do more strength-based work. And so the idea they had was that all the first questions they would ask when somebody called the child abuse hotline were strength-based questions. And then their families told them absolutely not, that when you're calling the hotline, you're calling because you're in crisis, and you can ask those strength-based questions after you've heard whatever the crisis is, but that it would just feel like you were being gaslit if it started out by saying, so tell me what's wonderful about going on in this family when you're calling in a child abuse thing.
Yeah. Thanks, Annette. That's a great example of the good intentions, what they thought was going to be, oh, let's do a strengths-based approach. And family said, absolutely not. Someone else to have an example of when you've seen outcomes change or trust built through family engagement.
I mean, I can go back to when I first kind of got started in this field as a child welfare caseworker and building trust with families and understanding the stress of a biological parent who isn't aware or doesn't have a relationship with the individual caring for their child while that child is in foster care. And so I spent a lot of time helping foster parents understand the importance of developing relationship with biological parents to support re recovery and reunification. And I've kind of carried that, I think, forward through different roles in my career in child welfare and in nonprofit work, to try and support parents.
Great. Thanks, Adam. Priscilla.
Yeah, what I have seen in my experience, my lived experience as a mother of four children with behavioral, mental, and disability challenges, and also with the families that I have worked with, is reduce stress, reduce isolation, navigating the challenges of a child with these challenges can be overwhelming and isolating for families. So engagement provides them with information, with resources, connections to other families, who share similar experiences, and that reduces those feelings of stress and isolation.
Thanks, Priscilla. I love that. I think about that. It takes a village. And when you feel like you're alone in your village trying to raise a child, particularly if that child, well, all children, but sometimes some children have more special needs or significant challenges that can make it hard for parents who weren't ready to do that. I speak from personal experience, but yeah, having that someone to come alongside you. I think this reminds something that you said, Adam, and I think it builds off of Priscilla's too, is for us to remember that parents are the experts on their children. So we think about subject matter experts, and we believe that families know what's best for their children because they're with them all of the time. And I just missed a hand that went up. Wonder if that person wants to. Didn't see who that was.
I think it was Lisa.
Okay, Lisa, yeah, do you want to go ahead and jump in?
I think I'll wait. I'll pause. Thank you.
Okay. Okay, thank you. Thanks so much. Well, again, family engagement matters. And I think the fact that that the System of Care Advisory Council is willing to commit resources to figure this out, to begin to really build on some of the strengths that had already been happening. The fact that SOCAC does have two now, I think, going to 4 family representatives, really building on some of these early wins. And I, having interacted with Anna and with Christy and Joylene, I can attest that this is a staff that is very committed to centering family voice, very committed to centering youth voice, and ensuring that those are the voices that are impacting and changing programs and services and policies. Just pausing. Anything else folks want to add?
Tara, this is Lisa, and I was going to pause earlier, and I just needed a minute to kind of get my thoughts together, because I wanted to speak around this, why engagement is important. I think that there's lots of different ways and places that we can engage families, but when I think about the word engagement, it's connected to my own experience, my own living experience also, but it's also how families we can take our living experience and it sort of comes around full circle and gives it a purpose, right? So that when we're sharing, the purpose too, all of these other things that people have listed to reduce isolation, to reduce stress, to reduce all of the things. But it also it gives the things that we experience, the difficult, hard things, a place and a purpose of good. So that's another piece of engagement I just wanted to share.
Lisa, I'm so glad you shared that. Thank you so much. Um, I heard one of the things I heard you say too, which is true from my own experience, is that I typically don't get involved, and I've seen this with families when things are going well. We just it's not like, oh, I don't need to get in and change anything because everything's working great for me. But the reason I got involved in my local parent advisory council is because my child was not getting the services. Things were hard. And Lisa, I feel like I heard you say a little bit of that, of like turning that angst and that hard thing in giving it purpose.
Yes, right. The crisis that we experience, the really difficult, heartbreaking things that our kids experience. And when we can engage families, I think it gives them an opportunity to see that they're like, once this too shall pass,
Yeah.
right? And then when that does, there's a space and a place that, that you can be engaged in
Yeah.
to bring purpose to that.
Yeah. Thanks, Lisa. That is the power of family engagement. It not only transforms systems, it transforms the experiences that families have into something good. And I think that's a great thing for us to be centered on. Um, we're going to talk next. I want to share with you about what families said. And before I share these slides, I want you to remember that we had lots and lots of conversations with families, and we heard the good, the bad, and the ugly. We heard things that are going great. We heard things that are hard. Um, I think of one mama who I met with 3 times afterwards, not around this project, but because she was wanting help navigating systems. And I just met with her a few times because I know what it's like to be confused of where do I find. So we had several conversations afterwards. Families are looking for ways to engage, ways to have their child's story matters. I want you to hear some of their words directly. So I'm going to speak these out. You can imagine families speaking this. What families said. Systems love collecting family input, but rarely use it effectively. It feels performative. It feels like the whole lived experience movement is still very performative. They're checking boxes required by grants. They get annoyed when our voice goes against their agenda to protect the system. I had to learn how to talk nicely about my experience in order to even be invited to spaces of leadership. It shouldn't be that way. We're tired of telling our stories again and again without seeing anything change. It feels like re traumatizing ourselves each time. I'm going to pause and let these voices soak in. I have another slide with more family voices that have different things to say, but I didn't want us to candy coat with toxic positivity the experiences of family engagement and what families are truly experiencing. It's important that we hear this, that we sit with it, that we honor that things have been hard. And it's difficult, as Lisa suggested, when you're already experiencing a traumatic situation sometimes with your child, to when you come to a space where you're hoping to make a difference. to not feel that that is happening. Many of the recommendations that the Family Advisory Council is working on help to address these. So there's hope. I'm not going to leave you today with this kind of taste in our mouth, but we can't pretend that these experiences are not currently happening and have not happened with families. Families in the conversations that we had felt both, and sometimes at the same time, frustration and encouragement. They felt encouragement that there was a system investing resources to try to do better, to know better, and then do better. And then they still had their own feelings of not feeling heard and not feeling like every time they're asked to say something or to fill out another survey, they don't know what happens to it. So you'll see in our recommendations, the feedback loop is one of the key anchors that I want to leave you with today, with families knowing this process around you said, we did. So anytime you're asking families for their opinion, to participate in a group, to be able to name, you said this, we did this. And that level of transparency, it takes time, but that's what helps honor those family stories. All right, let's look what a few more of the quotes from families. I want you to hear their voice. Having someone who navigated these systems already come alongside me made all the difference. We need centralized, culturally responsive support and advocacy resources. Sometimes the interpreter services aren't enough. We need someone who understands our culture, not just our words. And compensation shows families their voice truly matters, but current policies exclude so many of us. In our final report, you'll read a few of the recommendations that are being polished right now by the Family Advisory Council that really elevate what's working well, of having a someone to come alongside you, another family representative. If you're in a group and you're the only person who is the family representative, that in and of itself it is hard, it's traumatizing, but having someone who can help be your partner or navigate and have community, again, it's not just people who look like me, although that is certainly important, but it's people who have my same experience. Having those people who've also navigated these systems before, and I'm sure many of you in your programs, have those peer mentor type program. One of this comment on the bottom, and we'll be going through recommendations here in a moment, but this comment on the bottom of centralized, culturally responsive support, I think families have trouble navigating. What we heard was where the resources are everywhere and we don't know where to go, and it feels confusing. So we have some recommendations around that, but I'm curious for you to think about in your own organization, is the way information is given to families, is that convenient for the system, or is it working for families and having families give input on that? And then we have a whole host of recommendations, which you might have read, around compensation. Families had a lot to say about compensation, and it was a little bit all over the map. But I think at a minimum, reducing the barrier for families to be there by providing childcare or compensation to support childcare or mileage, and compensating families for their time. And there were several programs in our research that used different methodologies for compensation, and some of that will be listed of where that you can find a little bit of that, some of the research, but really having families be a part of designing the family compensation policy. Okay, looking at my time. Great. Okay. Here's what families said. This is not the totality of what families said, but I have we've curated kind of a top, I don't know how many there are, top 11 list of recommendations from families. And if you have questions or clarifications, please feel free to put those in the chat. This first one, families recommended was to develop and fund a peer mentor program to provide support and advocacy trainings to parents. So again, we're funding these supports. There is an organization in the Columbia Gorge that has a model program that have some family advocates that they are doing. Develop a liaison program that builds on the current work of family navigators and community navigators. Consider consolidation of these positions across systems. This was a comment that came from several places and several groups, because there are several groups doing family engagement work and have family navigators out there. So the question becomes, how do we leverage the community wisdom and the family navigators that are out there? Right, this next one is to create a centralized, culturally responsive family support hub that includes comprehensive system navigation resources. There are several tools that are out there run by different organizations. Families sometimes got confused over which tool to go to where. So again, families asked over and over of they didn't want to have to find several websites to try to find their resources. This reform compensation policies to provide equitable, unrestricted financial support for family participation. Some families felt that the compensation policy seemed to indicate that some voices were more important than others. And if a family doesn't qualify for compensation, they might be less likely to participate, or at the very least to feel like their voice isn't as important. So this was a key point that came up in some of our conversations. Institute mandatory training for all system professionals on trauma-informed, culturally responsive care and communication. Families had shared several experiences where when they've had to share their feelings and their experiences, they did not necessarily feel like those stories and experiences were held with care in a trauma-informed way. So they're asking that training be mandatory. This is the feedback loop. Ensure transparent feedback loops showing families how their input leads to specific systemic changes. Again, as I mentioned earlier, this is the you said, we did feedback loop, making sure that families know, because I participated and said this thing is changing, or even this thing isn't changing. Families just want to know whatever happened with that group I participated in or that survey that I filled out. Again, I think families had a variety of opinions and ways that they like to receive communication. So we consolidated this into offer diverse, accessible communication channels, including multilingual video and social media content to improve information dissemination. We asked families where are they likely to go to get information, and many of them mentioned social media as a place to give and get information. And this last recommendation is to facilitate regular community-based engagement opportunities that meet families where they are, rather than expecting them to always come to the system. So several families talked about coming to family, tabling at events where families are already engaging. And I know many of you probably have done this tabling or coming to these parent cafes that are in neighborhoods. That seem to be a strategy that many parents enjoyed those parent cafes, but coming where families are already gathering at different community events. Okay. Questions about these recommendations? This is just a snapshot. We're going to be putting out a report after the Family Advisory Council has finished the work on their final recommendations, but I just wanted to give you a snapshot of some of the things that we heard from families. Looking for questions.
Lisa has hand up too.
Go ahead, I'll wait.
Okay. One of the things I'm interested in the Develop a Liaison program. I think one of the things that's tricky is that families are in so many different places, and depending on the community they're in and sort of their circles where they hear information. So like we're finding things like some communities, it might be the local laundromat that they would get information, or it might be a library or other kinds of places. And I'm wondering what your thoughts are about how do you do family engagement in a way that really reaches out to the families you want to serve and doesn't just limit to families who may be already deeply system involved?
Yeah. I want to open that up to the wisdom of this group. Many of you have been doing family engagement. Any of the rest of you have thoughts on Annette's question of families are in a variety of places. How do we, is that your question, Annette? Like how do we get to where families actually are?
Yeah, how do we kind of avoid just going to the same places? Like we've heard, for example, that a lot of systems count on schools as the way to communicate, but schools are not the best way to communicate for all families. They're great for some families, but not for families who have a lot of distrust of the school and education systems, for example.
I don't have a particular solution to your question. I think it's a good one to continue to mull over and to continue to ask, are we reaching all families? In our outreach recommendations, I think the error becomes when we rely on one strategy, right? Because what you're saying, Annette, families are not one size fits all, right? They don't, and we heard that listening to families, some families do want to have a social media, find their information or find you on social media, while others don't have social media, so I think it takes a multi-pronged approach. Be glad to hear from others of what their thoughts are on that.
Would it be okay if I jump in? This
Yeah,
is
go ahead, Lisa.
Um, I was just, I have some things about recommendations from families, but, what your question that you posed is such a great question. And I think about that, and then it gets more complex because all families have their own perceptions of mental health. It depends, there's so much, some people, some families in more rural areas, I hear that their kids have behavioral problems, but and that means mental health. And so when we're talking about reaching out further, I think it's a good question, is it gets so complex with how people view mental health and in their challenges in their communities. Um, One thing I wanted to share about what the recommendations that you shared from families, I appreciate you sharing their pain out. I think it's so important. Um, One of the things that you mentioned that's come up several times is how critical the feedback loop is for families. And it is so critical. I have been with families who are supported families to share their stories, been in spaces and places of being an observer of families telling their stories. And I was in a meeting and I heard the group of families ask, "So what are you doing with the information you gave me? I gave you," and there was no response. This was a group of historically marginalized families who came, were courageous, and there was no response. And I felt the pain in the room, in the space during that time. The other thing is this idea that families should come to the table prepared. What does that mean? That we should support families and prepare them to come and tell their stories in a certain way. And I wonder if that's like a shiny, pretty way, a nice way. I would love for systems just to be ready to experience families and their living experiences the way they come.
Yeah. Thanks, Lisa, for sharing that. I'm curious of, you might be referring to a family that said they had to, it's helpful to help families get their voice heard, but to not feel like they have to candy coat it, right? Or
Yeah, or make it pretty, or use system language, right? Like that we want them to come prepared and to share their story in a way that it can be heard, yes, and we also want it to be authentic. We want them to have the opportunity to be authentic.
yeah. Christy, I see your question in the chat is if we heard suggestions regarding how to address stigma families may be experiencing, thinking in particular about families who may be involved with child welfare or juvenile justice. Vanessa, I would invite you to jump into if you have anything. We did not
Yeah.
ask. We did not
Yeah,
ask.
I feel like that's a very super specific, and I think it depends on which way we're addressing it, right? There's the stigma in terms of either how some families feel uncomfortable saying, "Hey, I have a child with special needs," because they feel like their child is then, um or is, this is what's being involved because they're then a high needs family, or they're afraid of letting their K-12s. So this question is more so reducing the stigma that parents may have, or reducing the stigma that professionals, and then how the professionals are then engaging with their parents. So it's kind of or families, like how a two kind of a multifaceted question. But we did hear some bits about, how families would like to, when they go into either, whether it's requesting support. And again, we also heard families from that were from English speaking, where they received, hey, there was a lot of support. Then there was those folks, that parents that were only Spanish speaking, and they felt it more of like it was very difficult for them to ask anything because they were immediately felt labeled as like troublemakers, or it's going to be harder for them to receive any resources due to the language barrier. But specifically which more, yes, we did, multifaceted, which one, and I would love to hear more. So, or do you mean more professional side or family side?
Yeah, I was thinking more like family side. Um, parents who, and not just related to child welfare, juvenile justice, but might feel concerned that they're at fault, right? Or that they have kind of like failed their child.
Like bad parenting, hey, right? Like I'm
Yeah.
afraid to ask because they're going to say I'm a bad parent.
Yeah.
And yeah, I mean,
Yeah.
that's something where, um, big time, where sometimes they are afraid to request help and for fear that it isn't, they're not going to be understanding and fear of like, hey, this could lead to potential things where they're going to, there could be a child welfare report. Definitely did hear guidance of, I think this goes more so with like culturally responsive trauma informed that we heard from them,
Mhm.
that they really want folks that are welcoming and are able to not, I guess, pass the buck as well. So yeah, definitely did hear some, we did get some feedback on that. And their biggest thing was they would love to, the other big part was also saying like, hey, sometimes I'm managing with someone, and this was a big thing about, more funding for community navigators and to avoid burnout, because they know that they would have a trusted person that they would come in and it can come to, and then that person stepped up, is no longer with the company, moved to another area, and then it's, hey, I have to re-explain my story. I don't know how this person's going to take it. I don't know if they'll have all the resources that the previous person had, or they're being passed somewhere else, and they're not as responsive and understanding as person at one local community place. So that, I think that's why they push more so for the centralized and having that one point person that was either local or regional, that they would have that connection, that trust, knowing that they understood their story and they wouldn't be judged.
I think in follow up to what Vanessa said, and Christy, this when families asked for mandatory training on trauma informed, culturally responsive care and communication, I think that's kind of code for some of what you're talking about. So in one little bullet, we didn't on this slide. I think looking at really good training, and maybe some of your organizations have those of, and I would say too, families can help design like the training of like this language is harmful. We don't say that, we say this, or and again, I think allowing families, what I didn't bring today was a whole training on psychological safety. But I think as you cultivate psychological safety, there's kind of four components to psychological safety, but one of those is that feeling that people can say, that hurt, I can say my truth. I can say this is when you use those words that, so that we're cultivating that trust really in the group. Happy to send more information out on that, because I think that psychological safety building in groups, I've done a lot of that work with groups, and it takes time, and that ability for a family to say, hey, can we check in on that? Can we check in? Because we're not going to get it right every time. And certainly I haven't gotten it right every time. But, what are the trainings to do the best we can to be prepared, to not stigmatize, to not use language that is stigmatizing, to not, language like risk and risk factors, but we think about you talking about stress, and that all families feel stress. Okay, I put a few things I was trying to listen to the conversation, monitor the chat at the same thing. So Hillary, I just took a little, maybe Joylyn did too, but I just took a little snippet from the report that we sent out of, we did not ask families to give us demographics in terms of we didn't ask for a lot of demographics. In part, we wanted families just to feel comfortable being in the space just as a family. But we do know in the stories that were shared that we did have families from, I can't say that we had 36 counties, but definitely every region of, and that was part of our outreach. And Hillary, I'm not sure if that answers your question entirely.
Yes, it gives me a little bit of information. I think Tammy's question was also about demographics and just knowing how many minoritized communities that you maybe reach. I see you did 3 sessions in Spanish.
Yeah.
Yeah, and unfortunately we didn't we had some we didn't have we when in our outreach to do those groups, we did ask if families wanted participation in other languages, and we didn't have any requests for that. But I definitely think continuing to listen to families of different lived experiences. I know that we're looking for, and we got families that have experiences with with developmental disabilities, have children with developmental disabilities, physical disabilities, families that are currently involved with child welfare, juvenile justice. So that's kind of what we were looking for, is that breadth of lived experience as well. Hopefully that helps.
Wonderful. I was wondering, is it possible for us to take down the slide now? Did you want to?
Yeah, I'm going to take that down. Thank you.
Lovely. We've still got you spotlighted, but it just lets us see one another.
Right. Here I am.
Well, thank you. And I was wondering, did you talk to any of the family-run organizations like One to Another, Oregon Family Support Network, some of the others that are doing good work? I know there are a couple of Black and brown organizations up in the Portland area. Did you get into those organizations and get an understanding for the communities they're serving and what they do? I know some of them have some specific interests.
Yeah, no, thanks, Hillary. We have talked with some organizations. We tried to keep our time focused on listening directly from families, even though we know that, and there were a few organizations that we did reach out to, and some we heard back from, some we did not. That we have gotten very helpful family to family network, and I think there were folks from OFSN that were at our family our focus groups too. So thanks for sharing that. Other questions? I have some more slides, but I'm looking at our time, and I feel like our time probably is best spent in conversation as we finish this out.
So can I just give a takeaway, and maybe others have takeaways? So what I heard said was that families are continuing to say that we're not doing enough to include them in conversations, and they're not feeling heard when they're there.
So I would have to jump in and say not everyone. There were some that said, hey, with
Okay.
these organizations locally, things are amazing. But is anything 100%? No. The one thing that we did hear across the board is sometimes I'm being heard, but there is the biggest thing that was across was there's no circle back. There's no circle back. Whether it's their over surveyed, over focused group, it's like, hey, I'm bearing my soul and I feel like I'm saying the same things over and over. Then where do we go from here? And then if that work cannot be moved forward, what is the reasoning? Is it funding? Do we need to do into legislate? Like, is there additional steps that as a parent we can then do? But no, it was definitely not like no one. And I mean, like, and as I shared previously with some groups, they're saying amazing support. And other groups, unfortunately, they're saying, wait, there's tables available. They want to hear from us. So it really depended on the region. Unfortunately, whether it's the language access was truly one of the biggest things that we saw was they don't know that that's even available, how to access that, or is it a safe space to truly share? Unfortunately, also in our current state that we're in. But no, it was not. Some families really did praise the work that has been done and what they continue to do.
Well, that's nice. Thank you.
So I'm wondering a little bit about what is going to happen with this report. Like, how is it? So that's something I worry about in gathering information sometimes is will it, exactly the questions families are all asking is, will it actually get used in some ways that will be helpful?
Yeah, so I can take that one, Annette. I think folks know that the council is in the midst of developing our next 4-year strategic plan. So we have a big retreat coming end of July, and per statute, we need to have a new strategic plan to the governor by January of 2026. So this report is being shared and kind of digested by the Family Advisory Committee. And the appointed members of council plus additional family members will be at the retreat. And so we'll be looking to their recommendations about how the common thread recommendations are folded into the strategic plan. So kind of TBD exactly what that looks like will be guided by those family reps at that retreat, but it will be there in some way or another.
That's great to know, Christy, like that there's this sequence.
Yes.
Mhm.
Yes.
I'll add to that as well that a lot of what is in those recommendations is not necessarily like pointing to specific agencies on what they should do. Some of that really is just going to be more work on my plate, right? Is there a mentor peer system that I need to build within the SOCAC structure, right? So from our strategic plan, as well as work that I will be taking on personally in my role, maybe contracting again for other people to do, we really want this to be a report that is shared publicly on SOCAC's website so that if it happens to land on the governor's office or a local community-based organization sees these recommendations, if there are things in there that SOCAC is not able to do, we desperately urge our partners to do it. So I'll add that as well. There's a couple different streams of where this information will go, but it's not going to get shoved under the rug.
Yeah, and also to add to that, Darlene, just like the partnership, right? Like some of this might not be the council's work, but our partners' work. And I just want to call out our local system of care partners in this room. Like, the council provides $200,000 grants to each of those regions. We require some level of investment in youth and family engagement in those dollars. And so yet again, like here we've laid out the things you can do with that money, regional system of care partners. And I look forward to seeing it in your implementation plans due end of this month.
So my last slide says next steps. We took some of the next steps out. We are continuing a meeting later on this week. This month is about finishing up, kind of polishing, making sure that the recommendations are exactly what the Family Advisory Council, has taken from these listening sessions, and putting those together in a way that they can be just readable, a little bit more readability. And we are also doing making sure those are in 2 languages. So those recommendations, because we have families that are Spanish speakers on the Family Advisory Council, and will at least be in Spanish and English. So we're going to be doing that work and have a list, a template of some policies, a starting place of policies to consider. We'll be finishing that up. And I think that's about it.
I just have to add when it comes to the family advisory committee, like as Kara shared, like we really took what was shared and they have done have done an amazing job, as y'all said, of really being able to call out this will be more so CAC work, this will be regional work, and then this will be partner work because they're so involved in the system that they are aware of how these can roll out. So they have been such an integral part of this. That's what we're doing again, like she stated, polishing it and making sure that it's easy for you to take this in and say, okay, this is a SOCAC, this is a SOC, this is here. I'm here as a partner. And like as they requested, they also want this to be able to shared across the board with all those families that participated or any family that is just interested in the work going on, that it is easy for them to really take it in and say this was the voice of family shared across the state of Oregon. So that's what we're polishing right now. And I just have to keep saying amazing kudos to the Family Advisory Committee that they are just doing amazing work and helping us really get this out to make it as efficient and effective as possible. So
Great. Well, thank you all so much for your time. Please feel free to reach out to Vanessa or myself if there's any other ways that we can support you or your organizations. And we look forward to continuing to work with you all to make the system better.
Thank you so much. Will you send the slide deck?
I sure will.
Okay, so I will send the slide deck and a recording out later this week, and I'll also link back to those Google documents that we shared originally that get into a little bit more detail from the recommendations that were just shared today. Thank you all so much. Hope you all have a great afternoon.
Thank you.
Thank you. Bye-bye.
Bye. Thank you, Common Thread team.